Hello everyone, I am Dr. Jill Pawlowski, and I wanted to say a quick hello to you all, and I hope that your Napec conference experience is going really well. I know I've been enjoying my time listening to presentations and getting to talk to people. I also wanted to thank you for tuning in to this presentation recording, and I look forward to seeing your faces and talking and getting a discussion going in the Q&A after. Today I'm presenting about parental attitudes towards inclusion in physical education, and this study focuses specifically on high school-aged students and their parents. I'm presenting today on behalf of myself, as well as Dr. David Adams and Sarah Crye, who is a master's student with us at Humboldt State University. This study was done as part of Sarah's master's thesis work, so I wanted to give her a special shout out for all of the work that she put in to make this study happen and to get these results out to you. And congratulations, Sarah, on getting your master's. So inclusion. In the Individuals with Disabilities Education Act, or IDEA, stipulates that students with disabilities should be educated with their peers without disabilities in general education classes to the greatest extent possible. There have been a lot of debates about inclusion and whether full inclusive practices are the best model for both students with and without disability, and there's a long history of this debate. On one side, the proponents argue that inclusive education is some of the most quality educational experiences that are out there, as teachers have to make accommodations for all students, improving the education of everyone. They also state that having inclusive settings is an opportunity for students both with and without disabilities to improve their social skills. This is especially important for those students with disabilities who tend to have fewer opportunities in their earlier life to develop these social skills by engaging with their peers without disabilities. Finally, there has been some evidence that inclusive practices will increase acceptance of others by students without disabilities as they have opportunities to interact in successful environments with their peers with disabilities. On the other hand, opponents of full inclusive practices cite difficulties that can arise with the diverse needs of learners in the same classroom. That sometimes teachers' attention is pulled to the students with disabilities and less attention is provided to students with disabilities, and a potential could be for decreased learning if the needs are vastly different of the students. However, inclusive practices to the greatest extent possible are included in IDEA, and this has resulted in a push to get students into more inclusive classrooms as much as possible. As a result, the number of students with disabilities who spend most of their school day, which is cited as 80% or more in general education, rose from 47% in 2000 to 63% in 2015. It's likely that these numbers will continue to rise as more and more inclusive practices are incorporated into the educational system. Now, for inclusive practices to be successful, prior research has found that parental support is essential. That when parents of students both with and without disabilities support the inclusion practices, there are better outcomes in the education programs for all students, and that the parents, families, and caregivers can provide school districts with a better understanding of how well inclusion is working for all of their students, and they can provide critical information for the improvement of inclusion within general education settings. So how do parents feel about inclusive practices? Most of the previous research has been done in regard to inclusion in general education settings, so settings other than physical education. Parents of students with disabilities largely report feeling undecided about inclusion, and some parents report concerns about their own children's ability to meet their educational needs and to get the educational supports that are important for them to meet their educational goals within an inclusive general education classroom. On the other hand, parents also recognize that a lot of times in a well-done inclusive setting, their child with a disability does have more opportunities to engage in social interactions and develop their social skills. On the other hand, parents of students without disabilities have reported largely favorable attitudes towards inclusion in general education. And a lot of these parents have reported that they believe that their children will benefit from having children with disabilities in their class, and that they will also have an opportunity to improve their social skills. So it's interesting in this sense that parents of students without disabilities tend to be more favorable towards inclusion than parents of students with disabilities. Part of this may be that parents of students without disabilities may not have a full comprehension of the educational supports that some students with disabilities require to be successful, and how those supports are integrated into school settings. So these parents may not have had to think about some of these roadblocks that could come up in general education settings. So some of their perceptions of inclusion may be just limited to the social interaction aspects, which are very important, but maybe not always the whole picture. But that's general education settings. Well, what about physical education? And why is it so important to pinpoint this physical education in terms of inclusion? So as we all know, physical education plays a unique role within the education system. And in Californian teaching standards, it's the only subject with a social and emotional development as part of the standards for that particular content area. Physical education also provides the only structured opportunity for children to learn about physical movement and engage in physical activity. As we know that this engagement in physical activity is particularly important for students' health, both physical but also social and emotional as they age. We know that students who have better motor skills tend to engage in more physical activity later in life, and engaging in more physical activity later in life results in better long-term physical health outcomes, as well as more opportunities to engage with others. And engagement in physical activity will also decrease stress and improve mental health as well. So this physical education has this very important component of building early lifelong health skills. So how do parents feel about inclusion in physical education? Well, the results on this are a lot more limited. There's only a few studies that have really focused on physical education and have really focused on inclusion in physical education, and only 2 of them had a larger sample size. So one study used a survey that looked at, that asked parents about what was essential for placements of children with disabilities into inclusive PE settings. And this was a survey of parents of students with disabilities. The things that they noted were that they would like to see smaller class sizes, lots of program support for inclusion, that they would have physical and communicative skills in the students would be appropriate for inclusion, that the health status of the student would also be appropriate for inclusive settings, and that motivation of both the students with and without disabilities was going to be essential for an effective physical education program. In an interview of mothers of children who had spina bifida, they highlighted their concerns about inclusion in physical education. They had a lot of safety concerns and were wondering about accessibility of the equipment as well as the physical education facilities, especially when their children were using assistive devices such as wheelchairs. There was also concern about the structural support and whether or not the physical education teacher, as well as the physical education aides, would be able to provide appropriate education in a safe manner for their child. A survey of parents looking at their satisfaction with social inclusion in physical education found that parent satisfaction was associated with their attitudes towards inclusion in PE, perceived PE-related information sharing, and the types of disability and degree of physical inclusion that their student would experience. So there's a lot of factors that go into parental consideration of inclusion in physical education when we're talking to parents who have children with disabilities. So gauging how parents feel. Overall, preparing for this particular study, we found that there were actually very few studies on attitudes of parents of children with disabilities in PE, and none that included both parents of children with and without disabilities. Most of the work has largely focused on how parents feel about inclusion in general education settings. So we set out to gauge specifically how parents of students both with and without disabilities feel about inclusion specifically in physical education settings. The purpose of the study was to do just that, to examine the attitudes of parents of both students with and without disabilities towards inclusion in physical education through mixed methods. We focused this particular study on high school age students as well, because there was less information about high school students than there was about younger grades. Our sampling frame consisted of 1,000 parents of students at a high school in Northern California in grades 9 through 12. Parents were emailed a survey on their perceptions of inclusion in physical education, and 96 parents returned completed surveys. The survey was conducted anonymously online using SurveyMonkey and included 3 sections. The first section was demographic information. The second section was the items related to their attitudes towards inclusion in physical education. There were 11 items in this section, and they were all scored on a 5-point Likert scale, where a low score equals less favorable attitudes. However, some of the items were reverse coded, which would indicate that a lower score had a more favorable attitude. The third section was an open-ended question where we asked parents to share any additional thoughts or feelings that they have about inclusion in physical education. The decision to include an open-ended question was made to see if there were any factors that hadn't been considered before, or if there was anything that the 11 closed-ended items would not capture. The statistical analysis for this study was twofold. On the quantitative data, or the responses from those items that were scored on the 5-point Likert scale, the means and standard deviations are reported for each question, as well as the percentage of respondents. T-tests were also ran to compare the responses from parents of students with disabilities to parents of students without disabilities to see if there were any significant differences in reported attitudes. For the qualitative data, which is that open-ended question, these open-ended responses were reviewed and coded for themes to find similarities and differences between the responses of the parents. So of our 96 total participants, 15 reported identifying as male and 81 reported identifying as female. 16 had students that were on an IEP and 80 had students without an IEP. Of the parents of students with an IEP, the breakdown of disability diagnosis is seen in this table. Most of the students had a specific learning disability, but the next most common was other emotional disturbance and visual impairment and autism spectrum disorder. Of those Likert scale questions, the following tables are going to outline each of the questions and give the percentages of parents who strongly disagree or disagree, the percentage who are neutral or undecided, and the percentage who agree or strongly agree, as well as the mean and standard deviation for each. You can see that each question asks about a specific aspect of inclusion. In this first table, none of the questions are reverse coded, so a lower score is indicative of a less favorable attitude towards inclusion. I want to draw particular attention to the middle question, which was, I believe students with disabilities should only be taught in inclusive physical education classes. We can see here that over 50% of the respondents strongly disagree or disagree, and less than 10% of respondents actually agree or disagree. So 90% of respondents are somewhere between neutral and disagree. This is particularly interesting, especially considering California's push to have fully inclusive physical education classes. That may not align exactly with how parents are feeling. In this next table, all 3 of these questions were reverse coded, which means that a lower score actually indicates a more favorable attitude towards inclusive practices. Again, I want to draw our attention to this third item. The question said, I believe students with disabilities will develop better physical skills like running, jumping, hopping, throwing, and catching in physical education class that is separate from students without disabilities. Now remember that a lower score would indicate that parents are more favorable towards inclusion, and in this case would feel that inclusive education would result in better physical skills. However, 60% of parents were either undecided or strongly agree with this question, meaning that they feel that an inclusive practice might not be the best place for students with disability to develop these physical scores. This result isn't particularly surprising, as there have been some previous research that indicated concern that the gap between physical skills of students with disabilities and without disabilities may hinder the development of students with disabilities as their peers engage in higher level skills. In this table, again, our questions are not reverse coded, meaning that a lower score is more indicative of less favorable attitudes towards inclusion. You can see in the first two that we have some pretty high responses, 4 and 4.2 out of 5, meaning that parents have very strong favorable attitudes towards inclusion in regards to students having more practice in developing social and communication skills, as well as classes promoting awareness of individual differences. In this case, getting at the idea that having students with and without disabilities in the same class would foster more acceptance of peers with differences from themselves. I want to draw our attention to the last item again here that says, I believe an inclusive physical education class is safe for students with disabilities. Only 55% strongly agree with this. The other 45 are neutral or disagree. This is a particularly interesting finding because it shows that there are a lot of parents that are concerned about the safety of inclusive practices for the students with disabilities. In our final table here, these items were both reverse coded, again meaning that a higher score is going to indicate negative feelings towards inclusion. These are both particularly interesting outcomes. The first one, I believe students with disabilities will take up a majority of the teacher's time in an inclusive physical education class so that they will not be able to give attention to students without disabilities. Only 45% felt neutral or strongly agreed, which is an indication that this shows that parents are still pretty split in their ideas of whether teachers will have enough bandwidth to provide appropriate skills and tasks for students both with and without disabilities to engage in successfully in the same class. The second item, I believe students without disabilities will not want to participate with students with disabilities in inclusive physical education. Only 14.5% of parents agreed or strongly disagreed, and 68% strongly disagreed or disagreed. This is a pretty positive finding from this particular study because it shows that many parents are starting to feel that their students without a disability or other students without a disability are going to be more welcoming towards students with disabilities. Indicative of the development of those social interactions and acceptance that have been noted in previous research about inclusion. In the comparison of responses of parents of students with disabilities and parents of students without disabilities, only 5 questions had a significant difference in response between groups. In the first question that had a difference was, I believe inclusion in physical education is not a good practice for educating students with disabilities. This question was reverse coded, meaning that a lower score is a more favorable attitude towards inclusion. We can see here that actually parents of students with disabilities had a significantly more positive attitude towards inclusion than parents without disabilities, in the sense that they feel that inclusion is a good practice for educating students with disabilities in physical education. In the second one, I believe students will have a hard time learning in an inclusive physical education class. It was also reverse coded, and we see again that parents of students with disabilities more strongly disagree with that statement than parents of students without disabilities. The third question, I believe inclusion in physical education can be beneficial for children without disabilities. We see here a pretty stark difference between the parents with and without disabilities, but here, the parents of students with disabilities have a much more favorable look on inclusion than the parents of students with disabilities when we're looking at the benefit of inclusion for students without disabilities. The fourth item, I believe an inclusive physical education class gives students with disabilities more practice in developing social and communication skills. Again here, parents of students with disabilities reported more favorable attitudes towards inclusion in this aspect than parents of students without. And the final question, I believe the presence of students with disabilities in inclusive physical education classes promotes awareness of individual differences. Again here, parents of students without disabilities had a more favorable attitude, because this question was getting at the sense of awareness of individual differences, meaning acceptance of the differences of others. The results from the qualitative analysis showed 4 main themes. The first was that inclusion teaches empathy. Many parents had highlighted that as they indicated their support for inclusion. The second was that students with disabilities should have a choice. This again was at the high school level, so more parents were thinking about choice than potentially parents of younger kids. The third, inclusion is beneficial but should be done on a case-by-case basis. And the fourth was identifying items that are necessary for inclusion to be successful. These items included small class sizes, teacher support, and teacher aides. Overall, we found similar results to previous studies on inclusion in general education, which means that parents' feelings towards inclusion in physical education seem to mirror those in general education settings as well. Overall, parents seem to be fairly supportive of inclusive practices, but parents of students without disabilities tend to be slightly more supportive of inclusion than parents of students without disabilities, especially when considering the impact of inclusion on social development and the impact on students without disabilities. Both parents of students with and without disabilities tend to agree that inclusion can have benefits for students without disabilities, but much like previous research, we see that those parents of students without disabilities have more favorable attitudes in this regard than parents of students with disabilities, meaning that probably the parents of the students without disabilities see that potential and that improvement for their students when inclusion is part of the practice, and parents of students without disabilities may not be as aware of these changes in those students. We also saw continued support that students with disabilities should be placed into inclusive settings on individual bases. Overall, there was mixed attitudes towards the outcome of inclusion for physical development and learning in physical education, which is particularly concerning because that is the opportunity for students to work on those physical skills and development of motor skills. So limitations and considerations for this particular study. The sample size of parents of children with disabilities was relatively small in general, but was also much smaller than the sample of parents of students without disabilities, which could have skewed some of the comparison results. The survey also included parents who had students in high school, and parents of younger children may have had different views, especially concerning whether the students should have a choice in their own inclusive placement. We did also receive feedback from a couple of parents that they felt that the survey was too broad and that they would like to see a survey that is more specific to particular disabilities. This indicated to us that parents may have different feelings about students with certain disabilities in inclusive settings than they do about students with other disability diagnoses, and that could be a potentially interesting topic to look more into in the future. So our conclusion is that global inclusion in PE is not necessarily desired by everyone, although parents of students both with and without disabilities did highlight the social benefits of inclusive practices for all students, but also that a lot more research is needed to fully understand parental attitudes about inclusion in physical education specifically, and to follow along that line that we had just mentioned about how parental support differs based off of the different disability diagnoses. Thank you for listening to the presentation, and I look forward to your questions in the Q&A.